president of the British Columbia Medical Association before it changed its name to Doctors of BC, and now the president of the Canadian Medical Association. So really an interesting time. Yes, ma'am.
Could you move the mic a little bit?
We've done that.
Would this be better? Is that better?
Yes, that's much better.
Thank you. Thank you for pointing that out. I would like to just divert for one moment to introduce you to my good friend and colleague, Dr. Alan Rudderman. Alan, please stand up for a moment. Thank you. Alan is the president of the Doctors of BC at the moment. He's been a good friend of mine for some years, and is a rural practitioner also based in Oliver, and has actually a practice which he tells me his average age of his patients is 76, so well versed in the issues that we want to talk about. And I might ask Alan, with your permission, to address us a little bit about some of the things that are happening on a provincial level here later on. Thank you, Alan.
Thank you.
So thank you so much, Mark, for the introduction and your overview. You clearly have a very interested, informed, and activist member of Parliament. I think you're lucky in that respect. For those of you that don't know, the Canadian Medical Association is an association of most of the doctors in Canada, 83,000 doctors, national association which comes together annually at least to bring all of the ideas from all parts of the country to be debated at what we call the Parliament of Medicine, and that just happened 2 weeks ago now. And a number of things were addressed there, including the CMA's push to support seniors' care in this country. So I'll be speaking to you on the one hand as a general practitioner in BC for a long time, who has had to deal with many of the issues that you have had to deal with, and also from the organizational standpoint of what CMA can do to help. And then we'll ask Alan about the British Columbia Medical Association as well. I'd like also to take a moment, besides addressing what has been a major piece for Canadian Medical Association, that of seniors care, to just ask you what you think about the decision-making processes that take place for healthcare policy and its management as we go on. So that sounds complex perhaps, but it's actually fairly easy. I'll talk about that in a little bit. Now, if I can work this thing. Yes, great. As Mark has already said, we've reached a turning point in this country. For the first time, there will be more people 65 years of age and older than there will be from the 0 to 14 age group. We, unfortunately, as a country, have not really got ahead of this wave. We have not really planned for this. And our system, which was set up to work well in the 60s, I don't think is keeping up with what the requirements of the people are in Canada. That was my message to the Canadian Medical Association and those attending that meeting 2 weeks back. We need to change the way that the healthcare in Canada is planned and is managed. So we'll come back to that part. So why should we care about the Health Accord? You may know about the Health Accord. It happens, this is actually the 4th time in, I think, the history of Canada that the provinces, all of the provinces, are coming together, happening fairly shortly. We haven't got a firm date, but I believe it'll be in the fall. So all of the provinces will be attending a round table with the federal government, and CMA will be making a presentation there as well around what shall we do with our healthcare system and how should we specifically support seniors' care. This health accord will address money. You may have read about that in the papers and seen that on the media. But I think it must be more than that. I think it must be about how we go about making decisions and who manages those decisions. So those are bigger questions, which, as I say, I'll come back to in a moment. It is, I'm ahead of myself, an agreement between the federal government and has the opportunity, the Health Accord has the opportunity to set stable funding and to address national standards. So the Canadian Medical Association has identified 5 main areas that need immediate attention. Deliver new funding to support the provinces and territories in seniors' care needs, and we've called that the top-up, the demographic top-up. So people across Canada are getting different levels of care, different levels of access, etc. So that is not what I think we would all want. We would all want the best care possible. That's not happening in all places. So in order to address that, the Canadian Medical Association has suggested that the federal government increase the monies that are sent to the provinces to provide healthcare, healthcare transfer funds, in a differential way to bring all provinces up to the same funding level. How that happens specifically is a provincial decision, but we must do what we can to provide that equilibration. And you can see the other 4. Expanding home care is a particularly important piece, supporting informal home caregivers, your children, your colleagues, your spouses, and improving the infrastructure to help support seniors. These are very important. The funding issue, your MP did address that. This is a piece that you probably know has been ongoing for a long time. There's been concern about how much money we're spending on healthcare for a long time. And that's an appropriate discussion. You can see that in BC, we spend 43% of our budget, of our provincial budget, on healthcare. That's a lot of money. And the question that arises is, are we spending this in the right way, or are we spending it in the best way? Do we need to spend more money on it? Where do we sit with this? And you will, I'm sure will know that seniors represent a big portion of this money. It is entirely appropriate. Don't misunderstand me for a second. It is entirely appropriate that we spend this money, we do this support, and that we bring all of the efforts of the healthcare system to help seniors. How we do that is a question that I think needs to be debated and thought about a little bit further. We're reaching a point, and you can see that you probably have heard of what's been happening in Ontario with the struggle between the doctors and the Ontario government, which really, when you step back from the actual struggle, is about how much healthcare funding is hitting the ceiling. So, is the call for more money simply the answer? So that's a question that I would really like your opinion on. Is there a better way to organize things? Is there a way in which we could help all of our people, you, yourselves, of course, all of our people help themselves better? These are questions that I think need to get debated, because that's a lot of money. There are a number of things that are a sort of ripple effect as we see the healthcare unfolding. Overcrowding in emergency rooms. I'm not sure what your Langley Memorial Hospital has and those sorts of waits, but it is a problem right across the country. Delays in getting care from general practitioners sometimes, from specialists, and diagnostic testing quite frequently, and of course that results in the long waiting times. So how do we think about that? And where is the best place for a person to get care? At home? In a community situation, a situation like this, for example, or in a hospital bed? Well, there's a cost factor to put into that. A hospital bed, on average, is around $1,000 a day. If you're occupying an ICU bed, of course that escalates. Maybe it's $10,000 a day. It's a lot of money. And compared to the support that one can receive in one's home, which I think most people would think is a better outcome anyway, as long as you don't get to a point where you need to have an operation or you need lots of intensive work. Vastly different, vastly cheaper, and much more sustainable. Comparable, high-quality healthcare for all Canadians. And if we can achieve some equality, equity amongst the seniors across our country, and if we can help with redistribution of the application of healthcare, then we can make our system more sustainable. Otherwise, we're going to come up to that ceiling that we've seen addressed in Ontario. We could have the same thing here, and that would not be a good outcome. Nobody benefits when we have a situation like we have in Ontario. So if we can deal with what has been referred variously, silver tsunami is one that you've probably heard, the requirement to provide the appropriate care to people who are getting older. If we can figure out a way of doing that in a way that's sustainable, that is going to help all of our system. So that is a priority. So our recommendation is to deliver new funding and do it in a way that is balanced. It is to spend our money, your tax dollars, my tax dollars, smarter, and to target specific areas such as seniors care in a way that is reproducible and sustainable across our country. This gives you an idea about how much funding will be received by seniors in each province should the federal government and the provincial and territorial governments agree with the Canadian Medical Association recommendation of this demographic top-up to provide equity across the country. CMA has been attending roundtables right across the country to ask for your opinions on this and to share with you some of the ideas that we have had and some of the ideas that we will be addressing both provincial and federal governments with. If you have further ideas, better ideas, we'd love to hear them and we will take them forward. The Demand a Plan website for improving seniors funding and providing that equity has had a huge amount of uptake. We have had 36,000 people sign on to that Demand a Plan website that CMA has put out, which is to provide additional funding to each province in the way that I've described. If you've not had a look at it, I would recommend that you do, and maybe tell your friends about it. And if you would like to add your voice to the 36,000, that would be very helpful. So, that's one of the questions that I'd like to place in front of you. Should the federal government provide targeted funding to provinces in respect of their aging populations? So I'd be interested to hear your opinions on that. And some other questions. Mr. Arawa provided you with some just now. Hope you're all keeping notes. We'll look for your answers on some of these too, if we may. And I'd like to add one other, and that is, how I referred to this at the outset, how do we go about making decisions in healthcare in this country? As I said, we've had 50 odd years of doing things one way, and we have slipped from being one of the world leaders in healthcare delivery to now being 10th out of 11 similar countries. The United States is number 11, and most of the European states, Australia and New Zealand, are operating at a higher level than we are. So I don't think this is good enough. And how we go about making that decision about how we improve our system is really, really important. We cannot go about doing this the same way that we have done for the last 50 years. What has been recommended for consideration, and again I would love your feedback on this, is to have a collaborative approach to decision making. Decision making between the federal government and the provinces and territories, decision making within the province, decision making within your hospital or region, and even decision making in the practices that you attend. And those would involve, that decision making process would involve each of the 5 healthcare partners. The people, yourselves, particularly seniors and particularly Indigenous people. Universities, and particularly the student voice within universities. Healthcare managers, health authorities, hospitals. Governments, federal, provincial, territorial, and the professions, particularly physicians and nursing professions. Each of those 5 healthcare partners can contribute to lasting solutions which are innovative. And to continue doing it with one of those partners making decisions about how everybody else is going to behave has got us to where we are. If we carry on like that, we can expect more of the same. So one of my other questions to you is, what do you think about that decision-making process? This is the website for Demand a Plan, and if you would like to join that and introduce that to your colleagues, friends, family, that would be greatly appreciated. The more people we can have that will actually strengthen our hand with the federal and provincial and territorial governments, the better. And if you would like to contact me or any of the other Canadian Medical Association folk, any of these websites that can be used, or I can provide you with my card personally. So thank you. Thank you for the time to listen to what I have to offer you, and I really would look forward to your advice on how we should proceed. But perhaps before we go there directly, I'll ask Ms. Laurie Godin, who is your Manager of Clinical Operations at Langley Memorial, to also give you a few words. Thank you, ladies and gentlemen.
Just a technical adjustment as we wait for Godin.
Hello, everybody. I see some familiar faces out there. So I'm taking a slightly different avenue. It's not about the health accord, it's about what we can do as we age for ourselves. And this session is part of the education sessions that we offer out in the community to the public. And this is just a small snippet of it. The session itself is about an hour and a half, and in that we do some exercises with you so that you can learn how to do them and talk about the various resources out in the community. So, but for today, we're just going to do a small section of that. Oh, I gotta hit the clicker. There we go. Things that are different as we age. What are things that you've noticed that are harder as you age? I want to hear from you guys. What kind of things? Give me a few.
Memory.
Memory is one. Picking things up off the floor. Pardon me? Oh, a few aches And new ones, okay, new eggs. Losing balance. What else?
Vision and hearing.
Vision and hearing. Anything else?
Loneliness.
Pardon me?
Loneliness.
Loneliness, yeah, social isolation. Okay, what are things that you've noticed that are better? And here's,
Don't sweat the small stuff.
don't set the small stuff. What else?
You appreciate what is there more.
Keep active.
Okay, so you appreciate what is there more, keep active,
Active.
yeah.
Have time to get involved.
You've- You've got time to get involved, yeah. Anything else? Okay, everybody experiences things differently. There's some hard stuff about getting older, and there's some easier stuff too, right? So, aging, we're all getting there, we're all gonna be old, and there's many ways of looking at it. These just happen to be two definitions. So one is acquiring desirable qualities by being undisturbed for some time. And an example of that might be some wine, some good wine. The organic process of growing older and showing the effects of increasing age. And that's just another definition. But basically, what does successful aging mean? What does it mean to you? What does successful aging mean to you? Any ideas? Remain independent. Keep busy. Healthy. Anything else? Pardon? Positive. So I heard a bit of attitude in there too, right? So these are a couple of slides that very similar to what Mark and Dr. Avery had. Maximum lifespan's about 120. You don't live that long. Life expectancy depends on the birth cohort and your gender and environment. Current life expectancy in Canada is 80 for men and 84 for women. And the cohort, BC has the longest life expectancy of all the provinces, and that's from Stats Canada 2012 and World Health 2014. So, and we've known that for quite some time that BC actually has the longest lifespan. And these statistics are slightly different than the ones that Mark said, but basically, back in 2013, about 15% of the population was 65 and older. Back in 1960, it was half that, about 7.6. So in 53 years, we've doubled the amount of people over the age of 65. And Mark, I think you said 1 out of 6 Canadians are 65 and older. These stats are from 2011 and 1 in 7. So, how is Canada aging? 30% of older people not in a care facility, so that means people living out in the community live alone. So that means the people that are living independently in the community, 30% of them are completely alone. The median income for household varies differently between male and female, and with the female having significantly less, which can affect lots of things as they get older. And about a third of people over the age of 65 will be hospitalized in any given year. And it can be for a minor thing or even something major. So I pulled some stats for Fraser Health, and this is looking at the amount of people that are living independently in the community. So 88% of people over the age of 75 are living out in the community, and 83% of people over 85 are living out in the community. So that translates into 7 out of 8 people, 75 plus, live independently in the community. And they tend to live out their lives there. So even though we may have this view that the majority of people have to go to residential care as they age, that is not necessarily accurate. Okay, so I'm here to help bring some hope to that and know that we can do things to make a difference in our lives. And then this is an interesting one. I just threw it in there out of interest. So, as I said, BC has the highest, or the longest life expectancy, so therefore we also have the highest proportion of seniors. And in Qualicum, BC, look at how high that is, 1 out of every 2 people. And that was from the stats in 2011. And it's 7 out of the top 10 communities are in BC. Any idea where they might be? White Rock's one, yes. No,
Yeah,
Victoria
that-
wasn't on there.
Maybe in
No,
Belgium.
not even Langley. Okay, so Kelowna, yeah, so White Rock, Nanaimo, Creston, Sydney, Parksville, and there's a couple of other places just outside of Creston, so it's Creston and then area, there's another, and Nanaimo, another place outside of Nanaimo. So a lot of them down in the lower mainland, probably because the weather's really nice down here. So I took a slightly different approach here. This is the centurions that we're seeing in Canada. And we're estimating, so here we are in 2016, and female outweigh men, but we're seeing more and more centurions, and the prediction by 2061 is quite significant. Do you remember in the news we used to hear the odd, like, happy birthday to Joe, he just turned 100? You only hear that maybe once or twice a month. Now it's almost every day on the news, right? There's more and more people. Yeah. So, and here's another view of living to 100. So what is normal aging? So this is kind of the bad news. We get slower, drier, thicker, and stiffer. So what does this mean? That means our reflexes slow down a little bit, and part of that has to do with just our nervous system slows down naturally as we age, and that can be one of the contributing factors to falling as well. Driving as well, our reflexes can slow down, that kind of thing. Overall, we're drier. Our skin tends to be drier, the wax in our ears gets a little thicker. Because it's drier, our mouths also tend to be drier as well. And one of the things that's really important as we age is to make sure we get enough fluid every day. And sometimes our thirst center doesn't really work well. It doesn't tell us we're thirsty. But to make sure that we're drinking enough fluid every day is a good thing. And the other thing, our midriffs get a little bit thicker. Has anybody noticed that? Yeah. And that's okay. It's nice to have a little bit of extra weight on because it helps sustain us in case of crises or we get sick. Too much is not good either, but kind of in that middle, have a bit of a spare tire there. And our joints tend to get stiffer as we age, partly because we tend to be less active and the fluid can get thicker due to dehydration. How many of you notice that you might be a little bit stiffer in the mornings? Yeah. What happens when you get up and move around? Feels a little better? Yeah. So the summary of the good news. As we age, we tend to be happier. We're way better at problem solving than we were when we were in our 20s. We have a higher life satisfaction. And we have wisdom. Wisdom is acquired with age. And part of the reason the research is showing that people are more happy is because we're content with less. We have a lot of experience to call on to problem solve. Things that used to stump us in our 20s, we can usually figure it out now. And overall, we have a really good sense of satisfaction. You can look back on your lives and say, you know what, my kids turned out okay, like I've got grandchildren, whatever it is, there's a lot of stuff to look back on. And so, thinking about the future, where do you see yourself in 6 months to a year? Eating at your own table, in your own house? Mexico, oh, awesome. I'm coming with you. I am coming with you. So, majority of people, when seniors have been polled, they want to stay at home and live in their own houses and live independently. And someone said that in the room today. So I'm going to talk about and pull from you, what are some of the things that we can do so that we can achieve that goal? So what are some things that you can do for yourself to successfully age? Any ideas? Eat properly, yeah.
Exercise.
Sleep, get a good amount of sleep. Exercise, yeah. What else?
Get involved.
Pardon?
Get involved.
Get involved, that's right. That's one of the really important ones is getting out into the community and get involved. Other ones are stop smoking, if you smoke, and it's never too late to stop smoking. Watch your alcohol intake, right? Pardon?
Many people drink more.
Oh, drink white wine.
White wine.
Yeah. Yeah, there's a debate, that lifelong debate, red or white. Okay, what are some of the things you can do in your environment to help you age successfully in place? Get rid of those scattered rugs and mats, that's right. Anything else?
What are some things that you can have in the house that will help you reach for something safely instead of climbing up on?
Yeah, so putting things, one of the strategies is to put the things you use the most lower down. So you don't have to climb things to reach them, and the things that you don't use as readily, put them up somewhere else. Don't use them ladder, yeah. Things like grab bars in the bathrooms, handheld showers, raised toilet seats. What else? Anything else?
Watch for your carpet to not fall.
Pardon me?
Watch for the carpet to not fall.
That's right, and some people go so far as to say you can remove the carpet out of your house, right? And just have flooring because it makes it easier. Wearing shoes that are slip-proof, or slippers that are slip-proof, so to prevent falling. Lifeline, yeah, that's something to reach out in the community. The other thing is your environment, keeping it clean and not letting it get too cluttered. And if you can't do that yourself, hiring someone to help you. One of the ladies I knew back a few years ago, she would ask for her birthday or Christmas present as gifts from her children and family. Just come and clean my house, or just come and paint, rather than getting things. She didn't need any more things. So just asking for that, hiring people to mow your lawn so that you're not having to do it if you're not able to do it. Any other ideas? And what are some of the things you can access in your community to successfully age? Any ideas there? Yeah, that's right, Seniors Resource Center. And what else? Anything else? Volunteer, yeah. There's this very much a statistical correlation between volunteering and worth and longevity and mood and all that kind of stuff. It's very, very important. Anything else? Pardon? The pool, yeah. Any kind of exercise program where you get out socially and get involved. Library, any others, like joining a club that you wanted to join, taking a class at the college. Did you know that most places have free classes for people 65 plus, so that's lifelong learning. All those kinds of things can really be helpful. Networking and getting grocery delivery into your house if you can't get out, right? Taxi savers, there's lots of things out in the environment, out in the community that you can access.
Give praise to the spiritual people who want to swim, and instead of leaving all the kids, the senior keep out from the pool.
Oh, okay. So there's a special seniors
Yeah,
time?
but
They don't
they
have to.
involve more the kids than the seniors.
Oh, okay. Well, that's something to bring up there.
Yeah.
I know, and I'm from Abbotsford, and in Abbotsford they have designated time for seniors in
Yeah.
the pool and on the walking track. So, and that's worked really well in that community.
Yeah, but the pool, probably.
Yeah. Well,
Yeah.
that's a good, okay, thank you. So one of the things that I'm trying to say here is there's lots of things that we can do for ourselves, and it's about being proactive and anticipating and doing some pre-planning for whatever that is, our environment, ourselves, or out in the community. And one of the things that's really important about connecting out in the community is actually builds a social network and a support system for us, which is really important as we age. So one of the other things is that most experts believe that genes explain about 50% of our propensity for a longer life. The rest tends to be lifestyle. So we can actually influence how long we're going to live by how we live. And it starts when we're younger and goes right into when we're older. So at the back, there's a handout, and basically there's 3 areas in life that if we do these things, they really can help us age quite a bit better. And basically maintain a high cognitive and physical function, avoid disease and disability as much as you can, right, by taking care of yourself, and engagement with life. And I'm just going to go through these slides very quickly. Exercise, physical activity is really important. It's important to do all of these if you can every day. Our bodies are made to move, and it's really important to move every part, every way, every day, just to stay moving. Balance is something that we can relearn even if we've lost it. We can start to do exercises to help that come back, and strength and also endurance. So this is just an example of flexibility. That's a class. What's the name of that? Anybody know? Tai Chi, that's right. What other exercises would be good for flexibility? Yoga. Pardon? Zumba. What else? Swimming, yeah. Another really good one is ballroom dancing. It's good for balance too. And then balance, like I said, it's like a muscle that needs to be practiced. Pardon?
Line dancing.
Line dancing, yeah, any kind of dancing. It really gets our balance, really gets our brain going. Strength, and being in the water or doing weights or thorobands are really great to add to that. And that keeps our muscles strong, and that actually helps us, our reflexes respond a little quicker. And endurance, that's getting our pulse up a little bit every day. How many of you walk every day? Excellent. So the target is to walk between 20 and 30 minutes every day, and walking is good enough. You don't need to do anything more than that. And you can increase it slowly, 5 to 10 minutes, up to 30 minutes a day. And then we talked about engagement with life. It's very important, and it's just as meaningful to older adults as is any other stage in the life, to be out there and involved and engaged. And nutrition, we talked about that. So when you think about that, just try not to have wasted calories. And one of the things we know is our taste buds do change as we age. We actually don't taste salt and bitter as well as we do sweets, so often we tend to have sweet tooths as we age, which is okay, but not too much. And this is just an example of a woman who is successfully aged. She's now 92, rides her bike every day to the bank. She has never had a driver's license. She lives independently in her home, and she grocery shops and everything on her bike. And this one is Ira Keeling. Has anybody heard of her? Yeah, so she was, I think, 67. I got to cheat and look. When she started running, and she, her 2 sons had been murdered. They had been involved in drug trade, and her husband died of a heart attack. She was very depressed, and her daughter was coaching a track and field team and said, "Mom, why don't you come out and try running?" Well, she hasn't looked back. She's now 92 and still alive and running, and she did 60 meters in just under 30 seconds. So she's pretty amazing. So the point is, it's never too late. And that's all I have. So thank you.
Thank you, Lori. Thank you, Dr. Avery. We also have with us today Dr. Ellen Rudderman and Dr. Leah Wong. Would either of you like to make some comments? And just in the interest of people, so people can see you, if you maybe want to come up here and speak from up here. And Dr. Wong, if you'd like to go.
So thanks, folks. Alan Rudderman. I'm a rural family doctor in Oliver in the South Okanagan, and I think you heard from Dr. Avery that in my family practice, my average patient is a 76-year-old woman, so I'm very, very familiar with the challenges and the health risks and all of the complexities that go with becoming older. And it's not just the population that's getting older. Family doctors in this province, the average family doctor is now 54 years old, and the average specialist is 53 years old. So at Doctors of BC, which is our provincial medical association, of which I'm now the president, there are 14,000 doctors and medical students and resident doctors that are really, really interested in your care and your well-being. And we've got 44,000 nurses in this province So they're the experts in nursing. Doctors are the experts in medicine. And we're very good about caring for you, but we're not the experts in caring about you. We care a lot about our patients. Caring about you are your loved ones and your friends and your neighbors. So I just wanted to say very quickly, Doctors of BC has worked very, very hard over the last year or so. We're putting out a policy paper later this year that we'll be presenting to our partners, including government. And it talks about the role of family and informal caregivers, being able to provide those people with the recognition and the supports, because they're just as vulnerable as those of us that are getting older and becoming increasingly frail. And we can't simply always focus on the people with the disease and the illness. We need to build a team of support around those of us that are getting older and need support. So we're very, very interested in that. Keep an eye out for that. It'll come out in the fall. And the other thing I should let you know is that the doctors in this province, we negotiate with government regularly on resources and supports for physicians, but we also have a very strong position and influence with government on what becomes really, really important. And government has now told us in this province they're interested in primary care. In other words, that's making sure you all have a primary care physician and provider to be there for you when things don't go well. They're very interested in seniors care. They are particularly interested in supporting those patients and people living in the small rural communities and the isolated places to make sure there's equity of service. They want to do their best to address access to surgery and making sure that people aren't sitting on wait lists unnecessarily long and taking painkillers when they shouldn't and all these other complications that occur. And so we're very aware that we're pushing in the right direction, but we need the community voice. We're only 14,000 doctors, students, and residents. We need the voice of the population across this province. It starts at a grassroots level, and that's why I was really encouraged to come along today. You need to raise your voice, you need to speak to your politicians, you need to write your letters, you need to get those messages out in the media. Without hearing your voice, we don't know what's important for you. So that's my message, and I'm just really thrilled to be here. I know you're all giving up time on a Thursday afternoon, and thank you so much for coming out.
My name is Leo Wong. I'm a family physician in Langley, and I have had a practice here in Langley for the last 15 years. One of my other hats is I serve as the chair of the Langley Division of Family Practice. And actually that's one of the grassroots organizations that, with the assistance of the Doctors of BC and provincial government, is a member organization representing the primary care practitioners, the family physicians and nurse practitioners in Langley. One of our big focus in terms of projects over the last few years has been to make sure as many of you have a family physician as possible. We're now transitioning to looking at specifically how to improve seniors care in Langley specifically. And together with Lori and people from Fraser Health, we have been working, and we've actually talked to many of you before about what are some of the more innovative ways. Things like making sure more of your care can be done at home, making sure that we have access to physiotherapy, occupational therapy, social work, and other healthcare professionals who can actually come to your home or be able to access them without having to go into hospital. This is work that's ongoing. This is work that we are very passionate about, and we know that you're also very interested in. We have something called a LAT, or Local Action Team, that we meet on a monthly basis to get a sense of, get a barometer of how we're doing, where things need to improve, and where things are going well. So at this level, we are really enjoying working with our community and trying to improve things. But I'm really interested in hearing some of your comments on some of the topics that have been brought up so far.
Thank you.
Thank you so much to our guest physicians being with us today. And so now it's your turn, and I'm going to pass this mic to Annette, and so that we can hear you, we can all hear each other. if you just raise your hand and provide your comments on the far right.
You know what I'm gonna say.
Thank you. My name is Sherry Baker. I'm the Executive Director of the BC Association of Community Response Networks, and our role is to do prevention, awareness prevention of elder abuse, neglect, and self-neglect in the communities. And we do workshops and education and so on around raising the profile and the awareness of this issue. We know, I think, Leslie, it's about 8% now of adults, older adults, are reporting having been abused. The reason this is and that's the reported, there's lots more that aren't. The reason this is a health concern is if we can, as communities, take this prevention measures and help our communities, help to make the vulnerable adults safe and be able to support them in the community, we'll keep them out of the system. The provincial government recognizes this and does support us financially, where we have activity in 143 communities in BC. And we, just the latest statistics, we touched over 90,000 people last year. We have 1,100 affiliates, part of our organization, and over $750,000 worth of volunteer hours. So we are, and we're doing a huge amount of evaluation, which after the last 5 years is showing that we are actually having an effect. So making that transition to keeping people safe and healthier and out of the system is important. Now, from a federal point of view, I'm involved with the Canadian Network for the Prevention of Elder Abuse. We're trying to get a similar model through that with the federal government, so that they will provide us with a small amount of funding. We need about $100,000 a year for it, which is pan-Canadian, to be able to manage to provide access and ongoing support for a hub, a knowledge-sharing hub that we've created that is the repository for all the research, all the programs, everything on abuse and elder abuse in Canada. It's up and running, and the stats, I just saw them today, some of the stats are huge, but we can't maintain it unless we get some more funding. And it's not grantable type thing. So that's my pitch, and I wanted to thank you for listening.
Thank you, Sherry. Any of our panelists have a comment?
Well, firstly, my congratulations, Ms. Baker. You're doing a wonderful job there. And it's certainly a very important issue. $100,000, as you say, is much of a drop in the bucket for the federal government. So I'll undertake to take that forward and see what I can do to help with that.
Comments there in the back?
And I think we have a lot on the news lately about Dog Day and his court case and really challenging the health court. And I'm wondering what the Medical Association itself, where does it stand on this issue?
Thank you for the question. It's certainly a topical one. It's one that I've been involved in personally for probably 15 years. The problem really is with our public health care. Dr. Day's challenge would provide for those with additional monies to be able to access care privately, if that were set up. The corollary, certainly where we are now, is that it would require more physician time, and the argument from the other side is that a doctor providing that service outside the public system means that he or she is unable to provide it inside the system. So the Canadian Medical Association and I personally would work strongly to improve our publicly funded service. It is fundamentally up to you, and I guess the courts will open the door, to decide if you want to have a parallel private service, or as Dr. Day describes it, as a hybrid service. And there are many people who will argue for that. There are a large number of people who argue against it. focus that the Canadian Medical Association has put upon this is to improve our publicly funded service, which must happen in any event. So addressing seniors' care and the costs associated with that are very important. And if we can do that in a successful way, one that accommodates the needs, but also accommodates the costs, which I believe we can do if we reorganize, then the need for a hybrid system, as Dr. Day would describe it, would actually retreat. And in fact, we've seen that. We've seen that happen in Quebec. The Choili case, which was 2004, I believe, which enabled Quebecers to access care, if it wasn't provided within a certain time, in certain specific areas only, on a private basis. That has actually not been taken up that much, I'm told. And that's because the Quebec government has redoubled its efforts to provide the care in a timely way to the public, or through the public system. So it brings me back to thinking about how we should design and manage healthcare policy. And there's 5 healthcare partners: you, the people, universities, governments, healthcare managers, and the professionals, all working together to achieve the best possible outcomes that are sustainable. I think that is where the money is.
While you're in this corner.
Hello, my name is Christine Spinder. I work with Sherry Baker with BCCRNs and also a project facilitator for a number of, I don't know how to describe it, intersectoral community organizational development projects in the Lower Mainland. And two things one of the things that's interesting that comes up from BCCRNs is because we bring together agencies from just about every sector that you can imagine, from RCMP to chambers of commerce to hospitals to seniors resource centers, but also from youth centers, is what is the role of elders in our community? And that we've completely lost even a concept of elder people having a role in our community. And the cycles of the rising tide of financial abuse, the rising tides of seniors becoming homeless. I was in a meeting this morning having to talk to an RCMP officer who said the highest spike in calls regarding suicide are coming from seniors facing homelessness. And I would put to you, Mark, that one of the biggest things you can do is to move the concerns of seniors from being outside just the health sector. And that this is something that is about what is the role of older people who have all these years of experience and wisdom, and how do we work with intergenerational programming so that our elder people have a role in our schools and in our communities and in our families, and that there's housing that actually supports extended family living and the kinds of housing that's starting to show up out of Europe and other places where commercial seniors houses that are centers that are only half full because a lot of people can't afford it are being filled with younger people who also cannot afford to buy new condos, and guess what? They're a great match. They get along really, really well. It gives seniors a connection to younger people and younger people a job. Back to the main focus, what is the role of elders in our community, and can you take it to being outside just the health sector?
Those are very good comments, important comments. It was about 6-8 months ago, we were at the Langley Senior Resource Center here, but in another room. And there was a person who was a senior and that has a disability, and shared that they needed some help. And yet help did not seem to be available for their need. And so I said, let's talk after, which we did. And it's their accommodation needed some work, and yet they needed assistance in getting that done. And it's now been 6 or 8 months, and it's just happened through some intervention, working with community groups. But there are seniors that they need help. And if they don't get that help, they could be homeless very quickly. And so we do not have that social safety net in a lot of cases. And so we need to think outside the box. And meetings like this maybe need to happen more regularly so we know what the issues are, and we do some thinking and volunteering and getting involved and helping one another. So thank you for what you're doing.
Thank you. That's a very pertinent question. I referenced earlier our healthcare system was designed 55 years ago, and it really has not kept up with the current demand. What has happened in our country is that we're living about 20 years longer, and that's great. That is a function of wealth, and it's a function of our improved social determinants of health, and our safety net as it is, and clearly can benefit from some improvement. I think your question about the role is really important, and it brings me back to how do we think about designing a health system that's actually going to be responsive. And when I think about the contribution that you, the people, can make to that question, I would include also thinking about how Aboriginal people, Indigenous peoples in our country think about the role of elders. We have a lot to learn. By all means, Indigenous peoples have been badly treated in this country and are still suffering from some of those effects. But they also are incredibly resilient, and they have some brilliant ideas about how to incorporate elders, young people, working people, all together. My practice in North Vancouver Island had a substantial portion of Indigenous people, and I learned so much from them, not least about the role of elders and the respect and the reverence that was accorded to those folks. I think we have a lot to learn if we can bring everyone together to talk about this.
And I just want to say, I agree, it's beyond health. Health is one component of what we are trying to do with seniors. And so it's about engaging the community, the seniors, and it would be lovely to be able to bring the different generations together, because the wisdom that the seniors can bring to that, and then the kids can bring different attributes. Like there's lots of different programs that were around. I don't know if they're around anymore, where grandmas go in and read in kindergarten classes, that kind of stuff, right? It really makes a big difference. Yes?
We just created last year a whole kit, manual, guide, PowerPoints, the whole thing on intergenerational work. It's on our website.
Excellent.
There's a ton of ideas there that you can adapt to whatever situation you want. We also have a whole protocol on working with Indigenous people. We have community response networks in some of the Indigenous communities, and many of those people also belong to the community CRNs. So we're learning from them, they're learning from us, and we're working together to make them safe. So we've got a long way to go, but all that stuff is on our website, and you're more than welcome to use it as you please.
Okay, thank you. That's good to know. Thanks.
Hello, my name is Leslie Godin, and I'm involved in a number of levels. We were very pleased last year to collaborate with the Canadian Medical Association and Dr. Chris Simpson and the Doctors of BC with Charles Webb, and we held a public health forum in Vancouver at the end of September. Out of that, a group of us, including the BC Retired Teachers Association, the Canadian Association of Retired Teachers, the Council of Senior Citizens Organizations of BC, and the National Association of Federal Retirees, has been working on a declaration. And this concerns a national health care strategy for seniors. It was a really interesting process in that we had about 20 people at a round table that included Dr. Avery. 4 of the 5 groups that you mentioned, the only one missing was government. There was an election going on. It was a little hard to get government involved. But I think there's a lot of different groups that each have ideas, and finding ways of bringing them together is a real challenge, but it's very worthwhile. I've also been working with Lori Godin and Dr. Wong, and having a great time trying to figure out local things in Langley. Anyways, the questions, I think the things that came up as we have been pushing this through the system, and I'm also on the Council of Advisors to the Seniors Advocate for BC, is prevention. People want to see prevention included, like Lori did. We had a great discussion with our multicultural community because they feel they want to see their needs represented, and we have got language in there. And the other thing that comes up time and again is access to prescription drugs at a reason, well, basically free. If you're in the hospital, you get your drugs free. In any healthcare thing I've been involved in, whether it's been cancer strategies, palliative care strategies, or breast cancer, it's when you move the care into the community, the drugs don't necessarily go with it, and it's a real burden. A final comment is in Langley, as we've sat around the Langley Seniors Community Action Table, is providing home care in the home sounds wonderful until you don't have much of a home to go to. Your home may not be clean and tidy, as Lori mentioned. It may have bed bugs and cockroaches and so forth. It may have electrical wiring that's not safe. So you need to have a good housing strategy in place along with that, as well as transportation in a place like Langley. So I think I've covered all the bases there. But anyways, I'd be very interested to hear any comments you have.
We have some comments on the second roll.
I'm Pat McKecker, and I live in a manufactured home, in a manufactured home park. We have a total in the lower mainland in Langley of 1,640 people, all seniors. And I will say, if you don't have a place that they can afford, and no builders are building anything reasonable for seniors, it's the wealthy seniors or the middle class. I was a stay-at-home mom, so I just have part of my husband's Canada pension and my old age pension. I'm 88 and a half now. I'm getting there. I'm going to be 89 in January. But it's so important what we have. But the news about SAFER, the news about HAFI, and home improvements is HAFI, that information is not getting to them. And unfortunately, our Langley CNO, the Central Fraser Valley Manufactured Home Association, is debunked. No, we can't get any people now to volunteer. And it's a shame because we have representatives of every park there for the meetings. And that was all our concerns. But there has to be something that we seniors on lower income can afford. I say, even if they put us in another manufactured home out of the area and had transportation 3 times a week, we could survive very happily. But no, sir, the land's too expensive. So the only thing the developers are interested in is big homes, big apartments, condos. We're all happy. We all have a good time. And we're lucky we've got an outdoor pool. But we have a social committee, and we meet once a month to find out what we want to do in the coming month. There are a lot of people that don't want to get involved, that's fine. But it's there, and the help for one another is there. So I wish they would do something to build for seniors that are on low income.
Thank you. Very important points.
I'll just address, if I may, excuse me, a couple of your points. And excuse me. prevention is extraordinarily important and needs to be addressed. And I really applaud you for forging ahead as you have done with that partnership approach. That's wonderful. Your points now around the home are very telling. And I spent a lot of my time in practice going into people's homes, and I've seen exactly what you've described, and actually way worse. And there is definitely a need for support for lower income seniors. There's no doubt about that. We think that that could be accomplished in part by the equilibration, this demographic top-up that we have been recommending to the federal government. The other issue that has come up repeatedly is prescription medication, and it's completely recognized that that's for some an intolerable burden, having to pay for that. And in fact, for some people, they actually can't end up skipping or not taking medication simply because of the cost. That's a tragic outcome in our country, tragic. CMA has called for a long time for a pan-Canadian prescription medication coverage. And by some of the assessments, we could actually save money if we do that. The problem is that it won't save money out of the same pockets that are paying for it. So that's the political back and forth that we have to do. I have to tell you that Minister Philpott, the Federal Minister of Health, at the Canadian Medical Association annual meeting 2 weeks ago, did not mention it. And private conversations have suggested that the federal government isn't ready to do that just yet. I don't think that's the end of the story. I think that you must be pressuring your MP, and you must be pressuring your provincial counterparts so that at the health accord, this can be brought up again and again and again. I think this is a fundamental piece we really need to get a hold of in Canada.
I think that was a very fair comment, and it's we've all seen the news over the last 2 years where a drug, a life-saving drug, is purchased by an investor, and the price of that drug goes to astronomical levels so they can get a substantial return on their investment, and yet it's costing lives. And so we need to take a whole new look at this. What our office does is when we get letters dealing with issues like this, we will hand deliver them to the minister. So your letter does not go into a black hole. It actually makes a difference. And so, Dr. Avery, you raised this issue a number of times of being involved with your local government, be it the mayor when it's appropriate for housing, to our MLAs, Rich Coleman, Mary Pollock, or our MPs, myself and John Alday. We work well together, and we live in one of the nicest communities in Canada, and that's because we work really well together. So by being quiet, your voice is not heard. So write those letters, make your comments, and we will make sure that the minister is hearing your voice.
Yes, I'm Marilyn Fisher. I'm the chair of AAA Senior Housing. We advocate for affordable, accessible, and appropriate housing for seniors in the Langley area. And I'd just like to echo the comments that have been made about housing already. The senior homelessness issue is increasing, and it's a huge concern everywhere in the province and in Canada. I would also like to acknowledge that our new government is looking into developing a national housing strategy, and I'm really pleased to hear about that. But I would like to hear about innovative programs for seniors, and I was wondering if either Laurie or Dr. Wong would be able to tell us a little more about the Seniors Links program that's being developed in our own community, and I think it's a very worthwhile endeavor and been part of some of the meetings
Okay, fine. I think Leo has left, so it will come to me. So the Seniors Link is a initiative that has been asked of 12 communities in the province, and Langley was one of the 12 that got asked to do it. And the idea is to design and do things differently in healthcare, to deliver healthcare to seniors. Our focus over the last 3 months has been getting an interprofessional team up and hired and ready to go. We've been working collaboratively with some GPs within the Langley, and there was 8 practices that came forward wanting to volunteer to do the test on this. And so we're just in process of this month, on September 21st, of starting the team, and it'll have a social work, a OT, PT, RN, LPN, spiritual care provider, and a pharmacist. In the offices, or if the seniors can't get to the office, go up to the home to see them. The idea is not to duplicate primary care or duplicate other services out in the community, such as home health. But we will definitely, the idea is to be responsive and be able to go out and see people and be able to do the whole team will have a higher core competency than other teams, so they'll be more specialized in seniors care. They'll have a bigger awareness of the things to look for, and then what can be done about that. So that's the main thrust of the last few months, and there's other stuff going on as well. We have that monthly meeting with the Langley Action Team, and we have developed a community resource guide. We collaborated with the Alzheimer's Society, Seniors Resource Center, Home Health, and we're just in the midst of launching that as well. Other things we're looking at in collaboration with the Langley Division of Family Practice is green sleeves. How many of you know what green sleeves are? A few of you do. Okay, green sleeves are can be in the home, and it doesn't. You don't have to be a senior to have them, and they basically have who your contact people are, what your medications are, and your advanced care planning, whatever that is around that. We're also looking at, as part of the Seniors Link, looking at acute care use and going to emergency. So how can we help support seniors in their homes so they don't have to go to emergency, or if they do go to emergency and need to go to hospital, how can we get them back home quicker? So does that answer your question?
Yeah, I just in terms of Pat's comment, Pat was a very helpful, voted member of the AAA Senior Housing Group. It's a small group of seniors, as I said. I think that some initiative for the Seniors Link to go into the manufactured home parks to provide some sort of support is underway, from my understanding.
Yeah, it is. So one of the things that we've looked at is the areas where it might be harder for transportation for seniors to get into the main core. So we will definitely go out to them. And part of that is offering education and sessions as well. And in the future, when the team is up and running, it may be that we do set up a clinic in those mobile home parks or manufactured home parks or wherever the need is.
And if I just might say, it's a well-known fact that housing is a determinant of health. So if we're looking at health, we have to look at housing for people that have a need for certain types of housing that they can afford and that meets their needs as they age.
Yeah, and I agree. Housing is it's one of the social determinants of health, for sure. And our focus is, we actually look at all the social determinants of health, and that will be part of the role of the social worker and the team, is to help find appropriate housing for people as well. Okay?
I think that's a wonderful initiative. The team members that you've described are tremendous. What we've also advocated for within BC is an approach to generalism in medicine, which encompasses a team response. And the physician may well be active in the community, as they are now obviously, but also active in the hospital, which is the model in rural British Columbia. But to have this encased, ensconced within a team would allow for different activities by the physician, different activities by the individuals, and I think would help to bridge that gap and accelerate the return to satisfactory living conditions outside the hospital. So there's a lot of interest in how we think about generalism in medicine and the team-based responses to how we reorganize ourselves. We haven't got far enough down that road yet, but if you think that's something that would be interesting, something that would be useful, if you have ideas about how we might actually bring that together, we'd be delighted to hear them.
So I'm going to bring some closing comments, and I want to begin by thanking our panelists, thanking you for your important comments, and I think there's a sense that we have highlighted the need for this dialogue to continue. We will have to grow and change and evolve with those needs. On the issue of housing, that's a passion for myself. I'm a handyman. I like to fix things. That's my therapy is to build. My staff is always laughing at me because I always have something on the go. In politics, it's a lot of negotiation and talking and debating, but my therapy is to build and to see something tangible done. So I would love to help somebody that has an accessibility issue in their mobile home or engineered home. If now they need a ramp that they can no longer use stairs. So I checked with, in Langley, we have a church in the valley that does these extreme makeovers. And so they've done a lot of good work and have an organization designed to help people that something tragic has happened and now their home is falling apart and they need help. But we do not have funded provincially, federally, locally, that I'm aware of, and if anybody knows of an association, so we don't recreate the wheel, of helping, a helping hand type of organization that would help build a ramp that would put the bars in the engineered home or their home so that you can help people stay in there, doing some of the practical redesigns. If there is such an organization, please let me know, because I'm not aware of anything, and I've asked a lot of people. One of the issues on that is engineered homes is very different than a regular house. The minute you start messing with a wall or the structure, a roof, you now have to get engineers involved as opposed to just a contractor replacing the sheeting or replacing the wall. As soon as you start messing with the structure, engineers, so the cost and the delays of actually getting it done, it gets very complex. So as bureaucrats and as government, we need to evolve and update how we make these necessary changes so people can continue living in their homes. If somebody needs some of the practical things with dealing with a home that really isn't very livable anymore, to be able to take care of those people. So I'm excited, looking forward that we can work together as a community to make sure we take care of our aging population. And I look forward to continued dialogue. Please say a thank you to Annette, Kim, Morgan, or Jane in the back for helping arrange this. And please do put your name on the forms. We cannot provide your feedback if we don't have your name. We're not going to use that information for any more than making sure it's not suggestions or recommendations from anonymous. The minister won't accept that, but if your name is on it, the minister will listen. So again, thank you for coming, and we look forward to hearing from you and working with you.